Discovery, and the shuttle has cleared the tower.
All right, we have officially gotten the countdown from Trip. He has signaled me that we are live. What's going on, you guys? Welcome to Health or High Water. Hope you guys are having a great day. Courtney, what is happening? How you doing today?
I'm doing fantastic. How are you doing, Brett?
Finally convinced you to come on in.
Yeah.
Super glad. Thank you.
You're welcome.
Time out. Trip, how you doing over there? Good, sir?
Great. How about you guys?
Good. Great workout this morning.
Oh, my back is sore.
Yep. Trip went all out today on the workout. Fantastic job. What else? Any what's going on? Any news? Anything new going on?
We have a new senior community working up with at Belfour and Longmont. We've been really excited to work with. Had quite the class here on Thursday. Might have been the warmest class we've had to date, but it was fun.
Trip needs to stop wearing sweatshirts to these senior classes, because then midway through he'll pop it off and all the ladies are like, woo!
Yep. Oh yeah. That is perfect clientele for you.
Oh my god. So we were just talking before about you're at how many? Could you count how many different communities you're in right now? Is it like 7, 8, 9?
Yeah, and then I'm probably 50 to 75% in kind of assisted living or independent living communities and facilities, and then the other portion in private residences and homes.
Could you take a moment, introduce your company and your role within that company?
Yeah, so I am Courtney. I am a physical therapist, and I work for a home care agency here in Denver called Optimal Home Care. And we do a lot of visits, and we work a lot with community facilities, so assisted living, independent living, and memory care. And so I am the supervisor of 4 of assisted living facilities in the area. And then kind of help out at other ones. We're mainly in Ascent buildings. So I believe there's 6 here in the Denver area. And I know that's kind of how I met you guys, is through those.
Mm-hmm. Yeah, okay. Is there 6? Because I know they...
5, right?
5.
Okay,
yeah.
Close enough.
There's one like out of state or something like that. Or something.
I believe you. Yeah, clearly I didn't do my research.
So is your day broken up into, are you going to different locations every single day? Are there times where you're just at one? Yeah.
So I try, and it's always easier said than done, of going to one facility just one time a week, but being in home care, and I have to keep some of my schedule open throughout the day, just for last minute referrals. So I'll then try and pick those up if I can, but it kind of happens that I'm going back to a couple of my main facilities a few times a week.
What's the workload like if you look at your day to day? Like, because you said, would you consider yourself a manager? Is that?
Not fully. More so like a field supervisor. So being a physical therapist, I supervise a lot of physical therapy assistants, and I do a lot of the initial evaluations, the reassessments, and the discharge visits, as well as some treatments here and there. But I then am the lead at a couple facilities. So at those main facilities, I go to the resident review meetings with the executive directors of those facilities to do any fall prevention. I work with a really cool AI company called Xer, and we do gait analyses once a month. And then with that, kind of identify different fall risks or gait speeds or abnormalities based on special testing within physical therapy. Mm-hmm. So I do kind of some more superfluous stuff outside of then those main treatment visits. So my day, in probably a typical week, I have 4 to 5 hours of meetings, and then the rest are treatments.
Where'd you go to school?
I went to St. Louis University. So I went to a really cool program where it was direct admit, 6 years, 3 years undergrad, 3-year doctoral program, and graduated 6 years ago now, and been a PT ever since.
Do you play any sports when you're in high school?
High school, soccer. And that's kind of the tale as old as time of how I got into PT, is had a sports injury and then thought I was going to open up my own sports clinic and went to PT school, and then found quite the passion in opposite sense of I did inpatient ICU and wound care for 5 years, and then made the switch to home health a little less than a year ago now.
Do you spend a lot of time in the car?
Oh, yeah. Yeah. So much more now. And I've learned all the tips and tricks of where good bathrooms are. I know all of the great libraries here in the Denver area if you need recs. Yeah, it's a great spot to sit down, get some cool AC in the summer, and kind of have a quiet place to have a desk. And then, yeah, definitely learning tips and tricks of the easiest foods to eat in the car, too.
Oh, yeah.
So,
Wow. Oh, so
Yeah.
you really do spend a lot of time in the car.
yeah, I really do.
Because Brett and I on this past Thursday, we spent 6 hours in
Going
the
up to
car.
Longmont?
Just literally, from there back, Longmont. Yeah.
Yeah.
It's absolutely insane. So, as I'm hearing, you're going to all these different communities, you're going to people's houses. Like, there's a lot of time in the car.
There is.
Do you have like playlists that you got going on for that?
Yeah. So I make a lot of physician phone calls too, because we need referrals. And so being a supervising therapist, that's on me of reconciling medications that patients are taking, making sure there's no severe interactions, and then getting verbal orders for plan of care, sending any updates on changes in vitals or new symptoms, or if they go to the ER, things like that. So I do that probably 25% of the time. And then the other, some music or podcasts. So I was actually listening to y'all's podcast here this last week, doing my research for coming on here.
What am I getting myself into?
I know, I almost backed out this morning. No, I'm kidding.
Is there ever any, are there nerves coming onto a podcast at all?
Are there what?
Nerves?
A little bit. It's kind of more so like the anticipation and then...
Like what?
Yeah, and kind of what am I being asked, but then it's just conversation.
Yeah.
You guys are such personable guys; it's easy to talk to.
That's awesome. What episode did you listen to?
This morning I listened to the most recent one on the what
Carly?
was it? Yeah,
The neuro.
the neuro. Yep.
is
Yeah,
that posted
and that was
already?
awesome.
Yeah.
Yesterday I think.
Trip is just...
He's on top of it.
He is on top of his game. I quickly realized he's the real talent. That's cool. So what's your day-to-day is a lot of everything. What do you like is there anything like you really love? Obviously work is work, right? There's a lot going on. Your job sounds like there's a lot of serious stuff in it. If you're talking about people's medication, physician phone calls, what's like fun? What do you enjoy about it?
Yeah, I love just kind of making it a personal plan of care. And I think that's the awesome thing about healthcare and being in kind of a profession that encourages independence and mobility and optimization of that. And I think it's really cool to talk to people and say, okay, what is your kind of life story? How did you get here and where do you want to be? Like, what are your goals to get back to doing? And let's make this a realistic goal together and work towards what you want. And so getting creative with those things, being that I don't do as many treatments, I don't get that opportunity a whole lot. But this morning I worked with an 87-year-old and she jumped for the first time in years. We went skipping up and down the hallway and she was like, oh my gosh, I never thought I could do this at this age. And I think, it's fun to try those new things and not be scared because this population, they're fragile, but they're not as fragile as we think they are.
Yeah, that's why they take our boxing class.
Right? And they beat up on you both. I've seen it.
My tendonitis is flaring up so bad.
Oh my God.
Come see me for some PT. Yeah.
Oh my gosh. All right, I got it's not a serious question, but let's say hypothetically you're training somebody for your position. Let's hypothetically say you're leaving your position. What advice would you give for I'm trying to think how to say the question. Not like what's the hardest thing about it, but what advice would you give to yourself? Like, is it just balancing the schedule? Is it just being like attention to detail? What is it?
Yeah. So for PT as a whole, I would say give yourself an extra 5 minutes and listen. That is kind of the best thing about no matter where a patient is in their journey, meeting them where they're at and really understanding and relating to them, because everyone has something that they want to get back to and everyone has something that they're passionate about. It's just if you actually take the time to ask the right follow-up questions and genuinely be interested in that individual and their care, that makes a big difference. And you can see people light up then when they talk about what they love and what they're passionate about. And it warms my heart. It's one of my favorite parts of my job. So generally in PT, that's what I would recommend. But for my current role, oh my gosh, be on top of your time management. I have right here my black book that is just lists. It is to-do lists of things to remember to do, people to call that I just jot down real quick and make sure I'm doing that. So staying on top of things, because it's so easy to get backed up, especially in home care when you're making your own schedule. Like I can take an hour off in the middle of my day to come do this awesome thing with you. But yeah, definitely is easy to get away from you and put it on the back burner and then overload yourself.
Yeah, it makes sense. Tell me about the 2 phones.
Oh my gosh, yeah. Well, I genuinely love a good separation of work and play. So I got my personal phone and my work phone, but I definitely am guilty of still checking the work phone. And I have only one app of communication on my personal phone, and there's only 2 people at work that have my personal number if they need me. So
yeah, what is the secret, Trip? What is the secret to separating work and?
You don't. You just accept that it's all the same.
Oh man, come on, give the people better advice, Trip.
Come on, Whitney.
Cry under the stairs.
Wait, all right, pass it to you. You're the guest. What's the key? What's the key? Obviously, you do a great job at what you do.
I'm getting better,
Okay.
But I think realizing at the end of the day, me engaging in the things that I enjoy doing makes me a better therapist in the long run. So taking time for myself, staying active, hanging out with the people I love, trying new things, all of those things not only make me a better version of myself, but make me a better therapist for my patients.
Along those lines, literally along those lines, one of the things that Brett and I love about this podcast is continued education. Right, we're constantly learning from other people that are better than us at tons of different modalities. Is there a certain continued education that you have to be a part of, and what's that time constraint look like?
Yeah, so every 2 years, so there's a national board for physical therapy, and every 2 years you have to get, I think it's 32 hours for a physical therapist to get continued hours of education. So that can be online modules, that can be in-person classes, hands-on labs, things like that. You can get, if you get any extra certifications, for example, in 2021, I got my certification in wound care. So I went to a 3-day course for that, took a nice long final at the end. You had to have experience going up to that. And it was kind of this whole long fun process. So that can translate into your continuing education. And the nice thing is you can really go into whatever sector you want. So you can do sports medicine, you can do pelvic health, you can do wound care, you can do anything really, pediatrics, geriatrics, all of that, whatever you're interested in, just you need to get those hours.
I like it. So I got a good question. I'm thinking of a friend of mine that I was speaking with recently, and I'd love for you to give some advice to her. But this kind of applies to a lot of people out there, especially young people, high school, college age. Obviously, they don't have life figured out.
Yeah.
You know, there's all these jobs now, right? And they're trying to figure out, what do I do with the rest of my life? What kind of work do I get in? Do I go get a degree, right? Obviously, you're a testament to somebody who's had a path that maybe started somewhere and then totally took these tangents, and now you found something you're good at and something you love. And who knows, maybe you'll find something. You never know. So is there anything you could say to like, let's say a high school or college age student who's interested in helping others in some way like this, but just isn't sure, like, what degree do I get?
Yeah.
Is there anything you can think about or speak to them?
Yeah, absolutely. So it is kind of goofy that it's always so surreal for me to think about that I picked this career path when I was 17. That's when I applied to PT school. That direct admit program got me in right away. I didn't have to do the GRE or anything like that. So it really was a special program, and I would be lying if I said I didn't ever have doubts or going through PT schools saying, is this really for me? But at the end of the day, I think the thing that helps solidify my understanding and my kind of confidence in choosing this career path is that it aligns with my interests and my values. And I think at the end of the day, work is such a big part of your life, and you should still enjoy it, right? It serves a purpose, but you can also make that purpose work for you. So bringing it back to, what do I enjoy doing? What am I good at? And what do I want to invest in? So I went the PT route because I enjoy movement. I was an athlete. I saw the benefits firsthand from an injury. And I love talking to people. I love spending time with people. I love science and math. The human body is fascinating to me.
For sure.
So kind of that culmination of things, PT was the best choice. But at the end of the day, going out there and learning about what different paths you can take. And so keeping an open mind. I was in a really cool program in high school that was a medical scholars program through Northwestern Hospital in the Chicago area where I grew up. And every Saturday, my junior and I think half my senior year of high school, I went downtown, did this program, went and learned about all different types of healthcare professions and shadowed these people. I saw open heart surgery as a 16-year-old. And so I got exposure to all of these things. So really keeping an open mind and learning as you grow and kind of seeing what's out there. And it's okay to change your mind. It's okay to say, oh, I wanted to do this, but actually, I really think I have a better passion for this, so it's okay to change your mind. Even in college, even as a professional, there are people who are in my PT class that were in their 20s, like late 20s, that weren't in that direct admit program. So just keeping an open mind and staying true to yourself.
I love that. Trip, what about you? I want to hear what your thoughts are. Do you have any advice on that? Because you are somebody who is a testament of working a lot, and you love what you do, and you put a lot of heart and soul into the sessions. Do you have any advice on work-life balance?
Well, something you kind of hounded on me to begin this business is prioritize, right? Prioritize things like, hey, listen, if there's something that has to be in today, get it done so you can enjoy that time with your family on a phone call, or enjoy that time to go out and play some music, write a book, what have you. Is use priorities. Not everything has to get done in a day. I'm one of those people that anxiously feels like it should, and I'll work 16 hours if I have to get it done, which is not the best. But that next day I'll take some time off to myself and maybe watch a movie or something like that. So having a balance and prioritizing is super duper important, at least for me, or I'd go crazy.
Mm-hmm. Yeah.
You watched open heart surgery when you were 16?
Yeah.
How did that happen? That was
a
program?
Yeah, it was through that program. So we just kind of went through and went through all of the different kind of professions and exposure. So went down to pharmacy, went down to the cath lab, went down to their gross anatomy lab with the med students, and got to see Northwestern. I think, don't fully quote me on this, but I think they have the largest preserved amount of fetal abnormalities, and so it's a great science kind of exposure for knowing all of these different abnormalities that might come out and how to treat them and what they look like and how to watch out for them. So it was wide exposure, from everything from watching open heart surgery to seeing a dissection lab with a human cadaver to going to a PT clinic and seeing them just do treatment sessions.
Are you grossed out by wounds?
No. Okay, the goofy thing is, so I have my wound certification. I've done wound care for a little over 5 years now, but I can't watch it on TV. Like Grey's Anatomy, where they're pretending, I know it's fake. I can't even watch them pretend to like cut in with a scalpel. I have to look away, or like pulling on stitches. Ooh,
why?
I don't know, but I can do it in real life. Give me any real life application. I've done surgical interventions of wound debridements with surgeons at a couple hospitals here, and I've done outpatient, inpatient, all of the different types of wound care. I can do it in person, can't watch it.
Have you ever done like an accident, like where somebody had like something like physically like I don't know how to say, impaled or something? Like you have?
Yep. Yeah. So I'm not a part of like the trauma removal process, but I'll treat then the wounds after the fact and kind of help manage infection and do like I've done around X fixes, so external fixators of bones that are crushed from a traumatic injury. And I've done a good amount. So.
Well, it's funny you said that about like it being on TV and being grossed out. I was listening to a news segment about that and talking about the music and the noises they put on films that changes everything. So like if you watch The Big Bang Theory without applause, it's a terrible show.
I have seen that.
Yeah. So I think it's the same kind of thing. Like they're putting like dramatic music behind it when they're cutting it open. Everyone's like sweating. It's like it's like
scalpel.
It's like, sir, we just started surgery and you're covered in sweat.
And those operating rooms are freezing, actually.
Why?
to help preserve just
Oh, that makes sense.
humans, 'cause there are a lot of them.
Wait, is anything to do with like bacteria growing in warm environments? And
Yeah, and one, their surgeons are in a lot of layers, and then two, to help with kind of just body management while they're typically on either bypass or on a ventilator.
so you've been in the surgery room all scrubbed up.
All
and
scrubbed up, yeah. It's very cool.
Is there like some sort of like not anxiety, but some sort of feeling that goes with that?
A little bit. It's kind of anxiety producing, but again, it's more so the lead up to that kind of like coming on a podcast or trying something new. Then once you're in it, as long as you know what you're doing, right? But then also having the humility to ask for help. There's that balance of confidence, but also knowing your limitations, and so relying on the people around you. But it is very, very cool and powerful to say, 10 blade. And the surgery assistants will give you a 10 blade, and you just go to town.
Wow. What's it called where they take kids to the thing you were just talking about, where you take kids to try different careers? What's
career day?
Yeah, but there's like a name for that, right? Isn't it like job shadow?
Yeah, yeah.
So we had a job shadow. I was in like 5th grade. I was like, I want to be a vet. Right? Like, that sounds cool. Like, helping animals.
Yeah.
We go to the veterinarian, and they're like, we got some really cool stuff for you guys to see today. It was just 4 cats that were incapacitated. and they were laying like this, and they're like, yeah, we're just cleaning their teeth. I'm like, this is not what I imagined. I was like, this is the worst job shadow I've ever. I was like, yeah, I don't want to be a vet.
So now you work on humans. Make them pass out then.
Yeah, I mean, obviously I like to torture people all day. All right, 5 more sets.
Yeah.
Wow, that is interesting. What do you got going on?
Well, we got a quick sponsorship word announcement real quick. One of the biggest tools that we have in individualized training is genetic testing, and that's why we trust the company Gene Planet genetic testing, because we were able to do whole genome sequencing. So as we learn about the genetics, only about 4% of the whole human genome that we actually know about, they'll be able to update your test, giving us more information to make our program more effective, getting healthier, fitter, and using preventive health measures. So if you guys are interested, use code APT at checkout for 30% off. That's code APT at Gene Planet Genetic Testing.
Boom, you heard it there. Genetics. Have you had your genetics tested?
No, I haven't.
This is pretty interesting. You should see all this stuff. You have any interest at all? Have you ever thought about?
No. We'll have to chat about that.
Yeah.
See.
Interesting.
Well, it's cool because
See
we're
your
able
spiel.
to like see like what your actual
Sell me on it.
we're able to find out what kind of workouts are best for you. As a PT, we actually find out injury risk. So if you have a potential risk for ACL tear,
Probably.
so we can.
It's gonna tear next week.
Yeah. Who knows?
We can build prehab programs so people know how to rehab. So it's kind of cool.
Could you guys have predicted my broken ribs?
Didn't you? Wasn't like a jump. You like?
It was snowboarding, yeah.
We could not.
That's okay.
Well,
It's okay.
there's got to be a statistic out there somewhere.
Probably.
So are you gonna go back? Right.
Yeah, I'm 8 weeks out actually today, so I just started some workout classes a couple weeks ago, but
Okay.
we got the clearance and we're
Okay.
moving in the right direction.
Good. Glad you're not in pain. That stinks.
Yeah.
That's a tough injury.
Yeah. We're back.
What kind of workouts do you do?
I love a good class where I can just turn my brain off. Being a PT, I don't know if you guys are like this,
Yeah.
where you're thinking for other people all day long and kind of building those programs. I have the ability to do it for myself. I just don't want to. And I'm going to be realistic. Like if I ever try and do that, I don't adhere to my word. I'll skip out early, right? I'm not fully honest with myself. That's maybe a character flaw there, but no, I like the community aspect of going to gyms and having somebody like a preset workout, somebody just telling me what to do, kind of motivating me throughout. So I used to go to a kind of CrossFit type gym, and now just started with F45 a couple months ago.
Oh, there you go.
Yeah.
45 is great.
Yeah.
Lots of classes, lots of options,
Yeah.
kettlebells,
Yep.
athletic movements,
Yeah.
core.
And it's quite literally half a block from my place, so no excuses there.
That's legit.
Yeah.
What part of town you live in?
Over in Uptown.
Uptown.
Yeah,
Uptown
not downtown.
Girl.
Exactly. Sing for us, Brad.
All right. So what is next for you? Obviously, you're doing great right now. Do you see like yourself growing? Are there opportunities to grow within your role right now? You don't need to spill the beans on any like crazy plans, but what's in the future for you?
No, yeah, I love what I do, and I love interacting with patients. Obviously, there are exhausting days, and it can be hard to kind of be on all the time. But I very much enjoy that, and I have previously thought about going into a non-clinical role, but at the end of the day, I think there's a part of me that would just miss it too much. So even if I transition to something non-clinical down the line, I think I would still have to keep up my skill set and do a couple days a week or just kind of PRN work with direct patient care. So we'll see down the line. Interested in those things. There is a lot of good growth opportunities in my company, and I love the people I work with. My bosses are fantastic. They're highly, highly supportive of that work-life balance and keeping kind of your stamina up, not getting burnout from doing too much too quick. Because here in healthcare, you kind of have to be a compassionate person, and so it can sometimes be taken advantage of. So my company is fantastic. So right now I'm enjoying it. We'll see it through. I come up on 1 year in August and then kind of go from there.
Yeah. Well, that's fantastic. Yeah, you're right. Burnout is real. I took a 7-minute nap right before you came. I'm going to be honest with you.
Power nap.
Listen, if you guys are listening right now, I'm going to tell you a secret. You might laugh at it, and that's fine, but I'm going to give it to you right now. Turn the lights off, lay down, don't put your phone on, lay down, and don't think about anything. All you need is 7 minutes in the dark, and boom, you wake up, and you're good to go. I've done it for the last 10 years, and I'm ready to crush it.
You'll have to teach me how to think about nothing.
I'm
not good at that.
Like, what? I was like,
7 minutes? That's terrifying.
As soon as my head hits a pillow, so my brain goes in panic mode. It's like, you didn't do this yet. You didn't do this yet. It's like, no, stop it.
To-do lists next to the bed. Keep a piece of paper. Oh.
Yeah, there's like all those tricks, but yeah, I'm sure there's like a get used to it process.
There is. I'm currently on 2 minutes in a rocking chair. I can't lay down yet. I have been practicing that.
A rocking chair. Do you remember when rocking chairs were a thing? Do they still make rocking chairs?
I know Cracker Barrel does.
Do they?
Yeah. I have one on my patio. Would recommend.
And that's a way to do something with doing nothing, right? I guess that's what golfing is, right? I mean, don't you laugh at me, Trip.
I'm just thinking like how much golf you watch and if there's like competitive like rocking chair.
There is nothing.
He's going real well here on the 5-degree angle. Oh, he almost fell out. Jesus, take the wheel.
Well, I mean, now you can put anything on the television. You can put a fireplace on the television and just chill and watch the fake fireplace.
I've done that before.
Yeah.
What's there's a rain one too. It's like rainymood.com and it's just a storm. You never heard of that?
Rainymood.com, no.
Yeah, me neither.
It's not real.
Yeah, cut that part out.
On that note, I know you're so busy. Trip, final words, anything you want to?
Courtney, just want to thank you so much for coming on and being such a pillar to the community, helping these retirees feel better and get fit.
Yeah, and you guys are fantastic. I hear from the residents all the time how much they love the two wonderful gentlemen that come in and do boxing.
Oh, that means the world. Well, we appreciate all the collaboration we've done already, and yeah, we're excited.
Absolutely. Thanks for having me.
Yeah, awesome. All right, you guys take care. We'll see you on the next episode. Peace out.